suction, this is the guard. So this will go in here. I only ever see these disposable now, but that's basically it. The suction tip, the suction tubing will get connected here. The other end will go to the circulator. I think that's what should be doing there, yeah? You got it right?
Yep.
Okay, because
I'm recording.
that's a lot of time on the pool section.
Do you have a skin? I got a skin saver. Do we have that?
No, we don't.
All right, Addison forceps.
Should I go?
Adson. So here's your Adson with teeth. This has got a very tiny teeth. Usually they're a little more prominent than that. Sorry. Your
Alright, okay.
Adson forceps with
A,
teeth.
remember?
Yeah, ADSON. I don't know if you're there yet, but you're going to pick them on the sharp end and hand them off that way. So.
You did that with
What's
us
that?
last week.
3 long. I don't know if we have that.
No, you don't.
Regular.
You do have a regular.
It's over there.
It's here somewhere. Yeah. Okay. So the number 3 is the most common one you'll use. It's not long, but it's the 4. Yeah. Sorry.
No, you're okay.
Yeah, and then 4. This one's, I've honestly, it comes in every set and I've never seen it used
Someone take them away as she's doing it.
Yeah.
Whoever,
What do
Becca
they
or
usually use?
somebody.
3 long and 7? What do they use?
Yeah,
The
the
deep?
3, the 7, the 11. It's, yeah.
Not really the 4.
Not really, but it doesn't matter. You need to learn it. It's fine. Curved Mayo scissors. So again, don't ever be afraid to pick them up. Bless you. They're similar to suture scissors in that they're heavy, they're weighted, they're for tough things. They use them in OBGYN surgery, for total abdominal hysterectomies. There's a lot of tough things to cut. That's when they'll want the Mayo scissors. Usually cutting tough things is GYN, yes.
Kenny was saying that remember tell the difference between the Mayos and us is they're fat, they're thick, and Mayo makes you fat.
Ah, look at that. All right. Yes, it do. Okay, cool. Straight
I know we have that one.
Yes, that's
Straightforward.
straightforward. It's what sometimes you'll want to keep it clean toward the end of the case for their dressing, and it's what they use to cut suture, or what you want them to cut suture with. They will cut with whatever you put in front of them, but the Gelpy self-retaining retractor. So,
But it
Doesn't matter. We've seen it before.
oh, okay.
Yeah.
So obviously very pointy, very pokey, painful. So yeah, that will.
No, you're good. Go ahead.
I think that's pretty self-explanatory.
Yeah, it
as
looks
a
like a
rake.
rake.
Looks like
Who's
a
that
rake.
specific?
Exactly. Yeah.
Would it be, I know, but like, would it be for skin or deep down?
That's usually deep down. They're not typically going to use that
That's
for
too heavy.
skin.
I thought
Yeah.
it was using something like that.
Okay, so yeah, these are the 2 that you have sized. So clearly a small. This one looks like doesn't matter. You have a small one and another one.
It's very malleable.
Because
as
usually
you can
there's
see.
3 in the set. And yeah, so the word malleable means that you can manipulate it, basically. And it's a handheld retractor because they use it as a retractor if they bend it that way. But they also use it to protect at the very end for incision.
Closing.
So they'll put it there and then sew the skin together over this so they're not poking what's inside. Army Navy.
Right there.
Yeah. Which one's
That's
the Army? Which one's the
self-explanatory.
Navy? I don't know. It is what it is. Yeah. There's a long-standing
first?
universal
like, which
debate
came
of which is
first?
the Army end, which is the Navy end. I don't know. So, yeah.
Sorry. We don't have the same.
What's next?
Oh, we don't have that one.
What was that, the
Then
Sean?
handheld.
15 one.
The one that goes like.
It's like the. It's
don't
like a
have
baby.
that one?
It's a baby. It's a very small one.
It's kind of twisted up, ain't it? I know.
Is that it?
Yeah.
Yes. And we had
Oh,
it.
yeah, the toothed tissue forceps.
We don't have any blades out.
That's okay. We know.
Two tissue.
Yeah, so the difference here is, let's see, there is no difference. So when you're looking for something with teeth, see how there's a V and then the little tooth goes in it? So there's 2 teeth at the bottom and 1 at the top that goes in it.
And this is at.
They're, right, they're,
And that's,
anything with a tooth is gonna have the same kind of tooth, it's just the size, right? So this is an Adson, it's for more delicate things. This is a little heavier, So maybe when they're doing suture at the end.
Is that gonna be considered plain?
No, it's tooth. It's
Tooth.
not plain. It's got a tooth. So it's considered,
Where is it?
Practice is
Yep. Perfect.
so yeah, penetrating, obviously this goes,
to the top.
makes a hole. So you want to be careful about giving them this versus non-penetrating at the beginning of the case, because you don't want them to poke through the dressing, the drapes, and contaminate your hole.
Oh, oh sorry.
Nope, it's good. Good. Mayo hair needle.
Hair. Now, these are debatable, like the way they look on the inside. So for your exam purposes here, this is a Mayo Hagar. It would help you to, look those things up in the book and see, because this has the cross hatching as well as that little divot, but they don't all look that way, so. Pro Glue Director.
Remember Disney, whoever said that last time.
Yes, little Mickey Mouse guy. So here's your
Oh,
Here's your
that's a
probe.
bad one.
little bald end is your probe. And then-
Remember Disney did that later too.
Mhm.
Disney
there
is
you
just
go.
the director, right?
Mm-hmm.
Just director. Oyster sponge down at the end.
No.
Oh, that's
No,
it's
Singly,
this.
that
I
one.
always mix those two up.
Yeah. Do you guys
Okay, that's
have
a four set. And
Raytech?
that's-
Raytex?
Yeah,
Yes.
there's
Can I
somewhere.
have just one?
Look inside.
That's the
yeah.
single.
Yeah.
Keep.
No, that's the Forester.
No, okay, do you
This
know
is
why,
Single.
Sheila, that you're
That's what she
thinking
was
of
ta- yeah,
both of
she
them
was pointing
together?
at
Tips.
Right, the
The
tips.
tips.
They're
But this
both
is a
kind of
pickup.
soft. They're not a big deal. Yeah, but this is a pickup, and what they're using this for is they're either in the vagina, kind of swabbing out, or they're deep inside trying to kind of move some things around or
Okay.
suck up a little blood without doing something as heavy
So they
as
put
actual
the,
suction.
sponges
So
on
yeah,
here.
it's not hilarious. I know. Don't worry about it. We'll
But you just
We'll come
put a
back
right
and
side
Single
down.
is used basically.
Wait, I have one.
yeah, yeah, we'll get to the same.
We're gonna go in order, okay?
Yep. Okay.
All right.
Sorry, guys.
No,
I just
no.
want to make sure we get everything.
It's fine.
on
Yeah,
here.
we were getting too distracted there. The Alice is here.
Alice has nails.
Oh, that's cute. Alice has nails. Yeah, it always looks the same. There's long Alice, there's short Alice. They're all like that, that little tiny hand with little teeny tiny fingers. They use these a lot in both bowel surgery as well as GYN surgery. Yeah. Like, and so when in GYN, I think of them as like the little fallopian stuff that look like that. So, anyway, but
That
has
makes
nothing
sense.
to do
No,
with
that helps.
yeah.
The wheat
So the Wheatlander.
liner, sorry.
Wheat liner.
Liner.
Wait, Lanner.
Yeah. Everybody
Spelled
usually
wrong.
says it. So this one's a sharp one, obviously. It's traumatic and sharp. You got those little teeth. But also self-retaining. Anything that has those ratchets on it is going to be self-retaining. Schnitt tonsil. Here's,
Oh, sorry.
yeah, so here's your Schnitt tonsil. Again, it looks like any one of your other hemostats, but it's longer. As I think Talal pointed out last week about using them for the tonsil, so obviously you want to reach back in there and not lose your hand. So,
Go ahead, Mom.
Oshner Cooker.
why do you have Edson forceps there with that?
Is that the name on the
No,
list?
I don't know why that's on there. There was something that was in the book.
Okay.
Might be one of the other names.
I don't know.
No, because these are Edson forceps
No,
right
they
here.
are. I don't know why that's on there.
Yeah, double check that, 'cause you don't want to.
In conjunction, like for specific
Hi, Ryan.
procedures.
No,
Like,
something was.
not really. I mean,
It's in the
because you're
book,
so
Brandy.
deep and
It's
you're
in the
not going
book. Or she's getting. Is it in the book?
Okay,
Okay.
let's, yeah, set
Sorry.
that, no, don't
No,
be
you're
sorry,
fine.
that's, I just was like, why
Perfectly
is that there?
fine.
The cooker, here we go. There's, again, your same exact tooth. See, there's the
Gosh,
two little
that's
guys and the
awful.
one on top. This also has ridges, so this is really meant to grab on and hold and not let go. So this is for hard stuff, stuff they don't care about, nothing delicate about this. So, it might not be politically correct, but because it's got such a German name, you can think of it like Oshner Coker. Intense stuff,
I'm
right?
gonna hear your voice in my head.
That's
That's
why.
why.
It might have been so that I could, that's what happened. I was looking through the thing and look, those are our Atson and look how much they look like them. Look, it says Atson Forset, but then it says Townsville Schmidt underneath it. That's why I wrote it in parentheses.
Okay.
So don't go back.
So the
Well,
Atson,
ask